Welcome to the Soulful Surgeon podcast with Dr. Lisa Hunsicker, a sanctuary for healthcare workers. In this space, we honor your stories, your struggles, and your triumphs. Here, you are more than your role. You are seen, heard, and celebrated. Join me as we explore conversations that nourish the heart, elevate the mind, and remind us why we chose the path of healing. This is your time. This is your place. This is the Soulful Surgeon podcast. Hi, everyone, and welcome to the Soulful Surgeon podcast. I'm your host, Dr. Lisa Hunsicker. This is a place where healthcare workers come to be seen and heard. And today I have a wonderful, wonderful episode for you. We have two amazing nurses, and not only are they great nurses, but they're mother and daughter. We have Elena Johnson and Stacey Simmons. So Elena, you're 6 months in, and Stacey, you're 28 years. She got her nursing degree when she was 2, right? Nice and young. So they are nurses, and now they're actually colleagues. And so really, when we talk about this is a wonderful experience because you can share your work and, of course, have the benefit of mom and daughter. This episode really want to focus on the beauty of nursing, but we also need to talk about the cost of it too and how that affects our emotional and physical health as well. And this is the kind of career that gives back, and sometimes it gives back greatly and sometimes very quietly. So thank you both so much for joining me today. So
You're welcome.
Elena, I totally want to start with you because you're starting, right? Stacey and I have been doing this for quite a long time, and we've been in healthcare for a long time. And I've had the wonderful privilege of watching you grow up, right? So I've seen you as a young person. And so, what is it exactly that drew you into nursing?
I think what drew me into nursing honestly was seeing my mom do it. Um, Especially like from a young age and hearing her stories and stuff. That was kind of what drew me to it. Um, and then getting to start out with my CNA and kind of like get my toes wet and like decide really what I wanted to do. That was a great experience for me. So that
Was
kind
there
of
any
what
pivotal
solidified.
moment that, when you were seeing all this, certainly watching mom, but also working in the hospital, being a CNA, was there any particular experience that happened that was really just, that really stood out to you that said, wow, I think I really want to do this?
I don't know if it was a specific moment, but more just seeing like how many things you could do with a career in nursing. And there's like so much diversity with um jobs and different patient populations and things like that. So I there's always something to do if you decide that you don't like it anymore or want something different or need to spice things up, which I liked.
Right. Now, Stacey, you've been doing this for a long time. What drew you? Did you have anybody in your family that was in medicine?
No, honestly, I've wanted to be a nurse since I was about 4. My mom said I started talking about it. Um, I loved my pediatrician and I loved going to the doctor's office. Like it never was a fear for me. Um, and then when I was 11, I think I had bacterial meningitis and was in the hospital for a couple of weeks. And I became like decent friends with my nurses. So I don't know. I think that really kind of made me want to help take care of people at the same time. But
And
that's just
so,
something I've always wanted to do.
was there anything that, as you're growing up, and obviously, what we decide when we're young versus when you're in college, was there anything that was really sticks out in your mind that said, this is my path. This is the thing I need to do?
Um, Nothing in particular other than I knew that I wanted to do it from being young. And then my first job in high school, I worked for an ophthalmologist. So not the same, but similar. It was still healthcare. And I actually ended up working in ophthalmology all through college, like high school and college, until I became a nurse. So I just have always wanted to do it, and it had always followed that path. I didn't really, I had a other one call it. I stuck to healthcare the whole time.
Great. And so now thinking about, both of you have been in medicine, especially Stacey, for you for so long. What is it when you think about people in the public? What do you wish that people outside of healthcare knew about nurses?
Mm.
Elena, what do you think?
I don't know. What do you think?
I think my first thing that I think is um I would say probably most patients know that we're here to help. But as a nurse, and I would say all of my nursing friends, our number one priority is to take care of the patients and to protect them. So while we might be doing things differently or disagreeing with someone's surgeon or physician or the hospital administration, it's always because our main concern is to protect the patient.
Mhm.
Okay. Okay. So, Elena, you're new. You've had so much experience still already in just these first, 6 months, and certainly with the CNA.
Mhm.
Tell me a time where a patient experience that just totally and fulfilled you, like sent you to the moon. You were so excited. Tell me about that.
Um, I think throughout like my being on orientation, um, almost all of my patient interactions have been very fulfilling, especially working in um like labor and delivery, getting to be with patients in a time that's so exciting for them and like such a big moment in their life. That part is really fulfilling and has kind of solidified like, okay, I feel like I'm in the right spot and knowing that this is like what I want to do.
And then tell me about a time where it just completely broke your heart.
Um, I think that like kind of going along with talking about being in labor and delivery, it's like the best time or the absolute worst. And that's something that I have kind of had to learn. Um, that like when it's not happy, usually it's really bad. So, um, it has been something that I've had to adjust to and kind of figure out like how to handle both ends of the spectrum and kind of know like you never know what you're walking into when you get to work. So that has been a little bit more difficult, I guess.
And how
Big
about you, Stacey?
emotional, big emotional shifts.
Yeah.
Um, I would say the same. Working in the operating room, I've definitely had to take care of patients who have not survived. Um, some of them being young, and it is hard. It's a hard emotional thing. But at the same time, there are times where we've saved people's lives, and it's satisfying to know that um throughout my life I've helped out in those situations and that people have been able to uh still be with their families and stuff because of the things we've done. But
Right.
along
And,
with that, it's exhausting and emotionally can take a toll on you.
Mhm.
And my husband will tease me and say that I'm cold-hearted, but It's not being cold-hearted. You know, you learn, you live, or sorry, you when you work in the OR, you have to learn to shut off some of those emotions and um just deal with what you have in front of you.
And so, with that in mind, what do you think the hardest day in nursing has been for you? Like, considering all the things you've done, what's the hardest thing you've ever done?
Um, probably working on the day of one of the school shootings in Colorado. And it's emotional because I was helping out, and then at the same time, my kids are in one of the schools that's really close to that, and it's happened multiple times to me here in Colorado, which, so while I'm working, I'm still thinking about my children who are in school, but at the same time, you can't think about those things. So you have to push those things into the back of your mind. And then things get settled, but patients are still waiting to have their surgeries that are scheduled. And it's a constant battle on those days of emotions, and then continuing to keep doing your cases because people are waiting. It's nothing stops when things start to happen in the community.
So, with that, how do you unwind from that? So, it's such a dramatic day, it's so emotionally exhausting. What do you do when your shift is over?
You come home and you're thankful that your kids are okay. And then honestly, I think probably the biggest help is always talking about it with the people that you work with because they're the ones that understand it. And
Right. And
and
so, Elena,
knowing that I'm always here to help in any way, and knowing that, maybe when you work a day and things don't turn out the way you want them to, that there's hundreds of other times where things were better because you were there.
and Elena, when you come home after a hard shift, how do you feel like that emotional weight shows up? How does that affect you, and how do you think that maybe other people experience you when you're interacting with them?
I definitely think that I overthink the things that I've done throughout my shift, or like how could I have done things differently? Um, Maybe like a little bit of anxiety for sure. But
That new nurse, I just want to do everything perfectly
yeah.
feeling.
Um, but luckily, kind of like she was saying, I have someone at home that I can talk to about it, and someone that I can call on my way home and tell them everything what happened, and she understands. So it's nice to have someone to talk to and rely on and kind of talk me off the edge, even if she just tells me that I'm need to get over it.
Sometimes she just needs to get over it. I think I like, as a mom, I like being able to help her debrief, like, well, okay, well, this happened. You couldn't control it. This happened. What did you learn from it? Because in healthcare or in life, honestly, any situation that happens to you, there's always something you can learn from it, right? And that's how you become better at what you're doing. So, you know, I'll tell her, do you need to go back to work and talk to somebody so that you can learn about this situation, or let's look it up on the internet, or, you know.
Yeah.
And Elena, does she ever come to you? Does she ask for support when she's got a hard day in nursing too?
Um, I don't know. I mean, you talk it out.
Yeah, I feel like I have. just by talking to her,
Hmm.
especially from the time she started as a CNA
Yeah.
and working in the same department for a while when she was in recovery and I was in the operating room. It was a good way for us to talk about situations or people that we had both interacted with
Hmm.
or
So
so
one
I
thing
definitely have talked to her.
I think it's interesting because you did mention about really disconnecting. And I do think that we have to, in many cases, in extreme situations, it's high stakes situations and it's dire for our patients. We have to be able to shut off that emotional component. But yet
Hmm.
we have to get through those moments. But then when we leave, we need to really pull that shield down and reconnect back to ourselves. What do you think when the healthcare worker, while at work and doing all the things, actually becomes the patient? And Stacey, I know that you have that experience.
Yeah. Uh-huh.
So tell us a little bit about that.
Um, well, while at work in the operating room, I had a heart attack. They think it was a coronary artery dissection, but before they knew that, I started having chest pain, and like a good nurse does, I refused to go to the emergency room. Um, they took me into the pre-op area and hooked me up to the EKG machine and could tell I was having a heart attack. And um, actually, my cardiologist talks about how he still remembers the day like it was yesterday because he walked into the room expecting this cardiac alert, and he said he wasn't worried about me, he was worried about the staff because they were all very anxious, and he said it was definitely not as a normal controlled situation because they all knew me and they all cared about me. So definitely different for them, for my friends. And then it was also, it's different for a healthcare worker because you know what everybody's talking about and you assume the worst because you see the worst all the time. Um, so it was definitely a different situation. Uh, but at the same time, we don't take care of ourselves. And that's one of the things, honestly, that I regret about that situation was I didn't take very much time off of work. They told me I could go back to work, and I was like, okay, I got to go back to work because that's my brain. I have things to do and I have to go back to work, and I have patients to take care of. And I have friends that I don't want to they're going to be short staffed if I'm not there. So, as a nurse, you don't take care of yourself, I think.
I
I
think
think I
in the
took 3 days
OR,
off of work. Huh?
I think in the OR, I think that you almost call in dead. You just don't take that time. And
Mm-mm.
even if you're going to call in dead, you need to give at least 3 weeks notice,
Yeah.
right? And I do understand that mentality because we've had physicians, the surgeons doing cases while they were sick. I know I personally have done it while I had pneumonia. I know one of our other surgeons operated literally within an hour of being diagnosed with a pulmonary embolism, and she had cases, so those cases needed to be done, and she just needed to get them done. And so,
Yeah.
and I think we have this camaraderie with not putting anything onto anyone else because I think it's an extreme job that everyone is doing and everyone is putting in hard work and not wanting to add more to other people's plate, but also not feeling like we can take that time because, like you said, you took 3 days off after a heart attack.
Yeah. Yeah. It's ridiculous.
So
But
if you had it to do over today and knowing now what you knew, knowing now back then, what would you have done?
oh, I definitely would have at least taken a week off. At least. Um, I mean, now my heart attack was different than a normal heart attack. So, and they did tell me I was okay to go back to work. I didn't go back to work before my doctor said I could go. Um, but yeah, I mean, I've worked with surgeons who were very sick working, and um we've told patients before where patients are in pre-op and we've had to tell them, I'm really sorry, but we have to cancel your surgery. The surgeon is canceling your surgery because they're sick, and their first, I mean, they've changed their whole life to work their life around having the surgery. So it's not an easy thing for them either. But then you tell them and they start to get upset, and you're like, no, 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 they would never, believe me. These surgeons would never cancel their surgeries unless they're dying right now. There must be something bad. They must be really sick. Or you don't want them to be operating on you if they have the flu.
Right. Well, and I can talk about my own personal experience. I know that I had been exposed to a patient that had parvo B19, and I ended up with this incredible rash. And I called my staff and told them to call the patient and find out, was there anything going on? And they had seen me. They were a couple weeks post-op, and they were concerned that maybe there was something the matter with their implants, and there was nothing wrong with their implants. And so my staff called in the OR and said, your patient says that you're contagious and that you have parvo. And the whole OR completely stopped. And I canceled the next case. And the patient, full well knowing that I was contagious and that she could be at risk, was really mad at me for actually not doing it. And I know another one of the plastic surgeons at our hospital, she actually tripped in the OR and she fell and she landed and she broke her arm. She saved the graft. She didn't drop the graft, and she was able to finish that procedure. And she actually did one more procedure before the day was over with a broken arm, and she broke her elbow. And then she went and had her own procedure to
Yeah,
fix
I,
it.
I actually remember that happening.
So I feel like we are tremendously dedicated to our patients.
Yes.
And
And it's
I,
not dedicated to the job, it's dedicated to our patients.
right.
And
And
I think
I,
I always felt that dedication to my coworkers as well.
right. And I think the thing that we need to be mindful of too is that we need to also show up with that kind of dedication for ourselves and our own health, because long term we can't sustain taking care of other people if we actually can't take care of ourselves.
Yeah.
So when you think about all this and you're feeling kind of burnt out, what do you do to help with burnout?
Oh, well, I was completely burnt out about 2 years ago. And that was when I actually changed my job because now I work, as you know, with supply chain. Um, and it was a way for me. I was struggling with the hours. Working in the operating room, you have to take calls. So I was struggling with getting called in the middle of the night because one night as a 20-year-old, or even two nights in a weekend as a 20 or 30-year-old is one thing, but you get into your 50s and it wipes you out for a week when you're up all night. So I was struggling with the hours. I was struggling with the physical aspect of working in the operating room. Um, so I started looking for another job where I could use my expertise to still help patients and to also help my coworkers. So I have this job in supply chain now. The hours are a lot better. And So I miss the OR. I miss the camaraderie of my friends and the surgeons, and I miss patient care a little bit, but at the same time, I still get to help take care of the patients. So that was
Right.
how I helped my burnout. Um, it keeps me working, but I still I still get to be in the hospitals. I still get to see some of my friends on occasion.
And Elena, so even though you're new, this is an incredibly demanding profession. So what is it that you do to help yourself recover from a really difficult shift?
I think kind of like we talked about earlier, leaning on the people around me. Um, I'm lucky to have a really good team at my job, and even though I am new, they've been super supportive of me, um, and like checking in on me even when I'm not at work after they know I've had a hard day. Um, Being able to talk to my mom, um, and making sure that I'm still like doing the things that I want to do outside of work. Um, like seeing friends and being with my boyfriend and um, making sure that I'm still putting effort into all of those things because I think that when it's really hard for me is when I kind of stop caring about those things um, and focusing too much about like what could I have done better and oh this day was really hard even when it's done and it's over and I've left work.
And so you've been able to watch your mom go through this process. And so when she had burnout, she set some boundaries and changed her job. What kind of boundaries do you maybe have now that will help you kind of stay out of that burnout place? What are your boundaries?
I think that honestly, the boundaries are something that I'm still learning how to set. Um, and that could just be me or just being a new nurse in general. Um, but learning to kind of finding the balance between still like being emotionally present for my patients and still like caring for them and caring about what's happening to them and knowing when to draw the line and being like, okay, I need to step away from this. Like I have thought about it, I've reflected on it. Now it's time to kind of put it away. Um, it's still a boundary that I'm kind of learning, but
And Stacey, if nursing had a soul, how would you describe it to people?
Um, we're ferocious, like we will do everything we can to protect our patients. Um, but at the same time, we're like we have the biggest hearts and the biggest drives to try and get things done safely. Um, and we truly care about the outcome of everything that happens in the OR. It's different. We're not just making a sandwich or making a meal and hoping that it tastes good, we all know how important every aspect of our day is. So we're driven, very driven to make sure that it's a great outcome.
I think in my experience, in medicine. I've been doing this for 30 years. And I would say that in my experience, the way that I really think about nursing is I think nurses are by far the most soulful people I know because the breadth of experience that you all have and the breadth of emotionality and being able to really be present with people in their most extreme pain and suffering and in their most extreme joy
Mhm.
and be able to walk them through it. And sometimes, right, as you said, not every patient lives, and so you go home, but that patient doesn't go home. But being able to be present with the family and even with the patients in their dying process, I feel like, gosh, there's just so much life and energy and emotion that you all bring that really I feel like there are no words with that. So, Elena, if you're sitting here and we're talking to this audience and there's a nurse here that is wrecked and feeling tired and unseen, what do you want to say to that nurse?
Um, I would say to think about like the impact that you have on your patients and really reflect on that part. Um, and even when you're with someone on their hardest moment or their hardest day, you're still making an impact for them, even when it's sometimes hard to see that. Um, just being there with them is enough.
Stacey, how about you?
Um, that I mean, very similar. Like you may not see the impact you're making, but um, that mom is going to be able to, like, if we're operating on a mom, she's going to be able to go home to her kids and take care of her kids, and then her kids will have her. Maybe we just made, maybe it wasn't something serious, but we made her feel better. Her kids are gonna experience a mom who isn't feeling sick anymore. And so, I mean, there's always that impact that you make downstream, that maybe you don't know about or you don't get to actually see. And that's one of the things in the OR is you have to not really care about seeing the outcome, right? Like, you help the surgeons do the operation, and then you send the patient off to recovery, and you most of the time never um, get to see the outcome or even hear about the outcome. Um, so you have to be happy with the impact that you're making, and also the impact that you make on younger nurses. I always love taking students because I felt like I'm helping to bring people up that are going to actually take care of us when we get old.
Right. So,
And telling people, they, like you said, they have to take time for themselves. I'm always telling the new nurses, like, you have to go to lunch. You have to take your breaks. You have to do, I know you care about your patient right now, but you need to go to lunch because you need to eat and you need to take care of yourself to take care of patients.
So as I bring this episode to a close, one of my most favorite things is to talk to healthcare workers about funny experiences that they have had at work. And this could be in the OR, this could be on the labor deck, this could be in the parking lot, it could be anything. So, Elena, let's start with you. What is just something that is just ridiculously funny to you with your
Hmm,
job?
I don't know. You,
I think some of the funny things you would tell me from recovery was Like some of the funny things the sweet little old ladies would say when they would wake up from anesthesia.
Yeah. Some of the little old ladies really wake up swinging. And it's crazy. I guess I had a lady wake up from surgery and she was saying the craziest things, saying that she was like, she wished she had a gun because she was going to come to the hospital and she was so angry. And then they ended up giving her a little bit more sedation and she woke up and she was the nicest lady. She was so thankful for everyone and like just kept saying thank you and was so cute and sweet. But she was just acting crazy when she woke up.
Yeah, that
And
was
how about
for
you,
me as
Stacey?
well. Probably the funniest things um were just the stuff people would say when they get sedated. Like years ago, we were doing like I don't know, maybe a knee manipulation or something on a young kid. Oh, it was a shoulder. I think it was a little shoulder manipulation on a teenager. Um, and his parents were sitting next to him and they gave him some sedation and we just did it in like the PACU and he's just started telling his parents everything and I was like, shh, stop, like you're gonna get yourself into trouble. And he was talking about how he was driving a motorcycle, his friend's motorcycle, and I was like, oh, I told his parents you really shouldn't be in here right now. Like just um and then one time I had you have little kids, little toddlers come in, they stick things in their ears and their noses. Well, we had a kid come in and we had to take him to the OR because he had stuck I don't know, it was a battery or an earring or something up his nose, but he was like 11. And I was like, okay, that's kind of, getting a little too old to be sticking stuff up your nose. The same kid came in a week later. He was a trauma. He was fine. He wasn't really injured, but he had wrecked his dirt bike. And I remembered his parents, and his mom just kind of looked at me and smiled. And I was like, he's one of those kids, isn't he? And she said, absolutely. He is one of those kids. And I was like, yep, you can always tell.
Well, I want to thank you both so much for joining me today, and what a pleasure to spend this time with you. I really I can't say enough about my nurse colleagues because what tremendous people all of you are, men and women. And you really can sit in the place of suffering and not only be there, but really be in the place of meaning. And I think that you demonstrate over and over again that joy and grief and sorrow can coexist. And I don't know how you all do it. You're just amazing. You're so fluid with it. So thank you for everything you do. And thank you so much for joining us. Everyone, take care and be well.
Thank you.
Thank you.
Thanks for having us.
Absolutely. Thank you for joining me on the Soulful Surgeon podcast. I hope today's conversation offered you reflection, encouragement, and a reminder that you are not alone on this journey. If this episode spoke to your heart, please share it with someone who might need it as well. And don't forget to subscribe so you never miss a moment of connecting with healthcare workers all over. You can find us on the web at soulfulsurgeon.com. You can find us on Instagram at soulfulsurgeon. And you can find us on LinkedIn at Lisa Hunsicker, MD. Until next time, take care of yourself the way you care for others. And remember, your story matters here.